It is Pride Month, and all month long here at Local 4, we are shining the light on both the joys and the challenges folks in the LGBTQ community face. One of those challenges, the pandemic, has led to a dramatic rise in suicides for young people who identify as LGBTQ. For years, the Ruth Ellis Center in Highland Park has offered life-saving outreach, including drop-in services, housing, health and wellness programs. As Priya Mann explains tonight, when this safe space had to go virtual, the nonprofit used every platform available to try to reach the most vulnerable.
Pandemic isolation has affected all of us in one way or another, but for young people who identify as LGBTQ, in some cases, it's led to life or death consequences.
So we've seen an increase in death by suicide during the pandemic for LGBTQ young people, which is heartbreaking.
Jessie Fullenkamp is a licensed social worker at the Ruth Ellis Center in Highland Park. When the world shut down last year, many young people who identify as LGBTQ lost vital spaces where they felt safe to be themselves.
To have to be inside of a home or a space where you don't have those moments is really, really difficult. And that isolation, that depression just takes a lot of the suicidality to the next level.
The Trevor Project uncovered troubling statistics. The national organization provides crisis and suicide prevention services to LGBTQ young people. Its 2021 report surveyed 35,000 people ages 13 to 24. It found 42% seriously considered attempting suicide in the past year, including more than half of transgender and non-binary youth. More than 80% stated that COVID-19 made their living situation more stressful. Only 1 in 3 found their home to be LGBTQ affirming, and 70% stated their mental health was poor most of the time or always during COVID-19.
We know that LGBTQ young people are not only disproportionately affected by homelessness, but also mental health challenges, substance use.
Many overdoses happen with our youth throughout COVID because of the stress, the social isolation, the lack of resources, the lack of what's next.
Pride parades and events were also canceled last June, and for some, that's their only opportunity to express their authentic self.
That congregation, when you take it away, they can feel isolated, they can feel sad. Honestly, the folks that are experiencing high rates of suicide and depression are because of lack of access to resources, not so much lack of access to pride.
The Ruth Ellis Center had to pivot to continue offering life-saving outreach support.
Telehealth was a huge switch for us. The young people were in crisis and needed to have access to spaces like Ruth Ellis Center.
More than 300 new iPhones were donated so some of our most vulnerable could stay connected while we were all apart.
It's access to the young people that they really have defined as their family of choice. That's extraordinarily important.
Ruth Ellis, always said, share your story. And in this last year, I think we all have had time to reflect. And I would encourage us all to especially listen to LGBTQ young people, because I think that there is a way of observing the world that we can all learn from that will benefit everyone.
And Pride Month is a huge fundraising opportunity for nonprofits. Earlier this month, the Ruth Ellis Center held their Stride for Pride event, and they're still accepting donations. We've got info on clickondetroit.com. In Highland Park, I'm Priya Mann, Local 4.